Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Hey everyone, welcome back to the channel. If you're new here, I'm your independent political analyst, no spin, no tribalism, just facts, context, and thoughtful commentary. Today, we're looking at a fiery Senate hearing where Senator Elizabeth Warren went head-to-head with Health and Human Services Secretary Kennedy over COVID-19 vaccine access. It's a clash of promises, science, and politics. Let's break it down.
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
it depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were
witnesses. And let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you are putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
Here's the background. During his confirmation process, Kennedy made a very clear promise. If vaccines were working for people, he wouldn't take them away, no exceptions, no ifs, ands, or buts. But last week, HHS announced that COVID vaccines are no longer recommended for healthy people under 65. That policy shift set the stage for Warren's pointed questioning. She pressed him hard, saying, if vaccines aren't recommended, pharmacies often won't administer them, and insurance companies won't cover the cost, which is around $200. In her view, that means Kennedy effectively broke his promise and is taking vaccines away, even if he insists otherwise. Kennedy defended himself, saying he's not taking anything away. Instead, he argued that HHS can't recommend a medical product without strong clinical trial data. He stressed that seniors and higher-risk Americans will still have free access at pharmacies. But Warren pushed back, saying that's a dodge. She argued that in practice, average Americans will find it harder to get vaccines now than they did a month ago. And she warned that if Kennedy is willing to reclassify COVID vaccines, what's stopping him from doing the same with other vaccines like hepatitis B? Things escalated further when Warren accused him of pressuring the CDC director to resign. Kennedy fired back that she admitted she wasn't trustworthy, contradicting his own public praise of her just a month earlier. Warren pounced, accusing him of putting public health at risk, and demanded his resignation. So let's step back. On Kennedy's side, his point makes sense. Government health agencies should not recommend a vaccine or any drug without solid data to support that recommendation. That principle protects scientific integrity and public trust. But Warren's critique also hits home. The federal recommendation isn't just symbolic. It directly shapes what pharmacies will offer and what insurance will cover. If access becomes limited or costly, then the promise of not taking away vaccines looks broken in practice, even if it's technically true on paper. This debate exposes a communication problem. Kennedy frames it as a scientific safeguard, while Warren frames it as a broken promise that undermines access. Both frames have truth in them, and the gap between them is exactly where public distrust grows. And when it comes to the CDC leadership drama, calling someone trustworthy one month, then saying they lied the next, those mixed messages only deepen skepticism about whether decisions are being guided by science or by politics. In the end, this wasn't just about vaccines. It was about trust. Warren sees Kennedy as breaking his word and putting people at risk, while Kennedy insists he's sticking to scientific standards. The problem is that Americans are left with less clarity and more confusion. My takeaway: this exchange shows how fragile public trust in health policy has become. Clarity and consistency matter more than ever, because without them, every policy shift looks like a political fight instead of a public health decision. Thanks for watching. If you found this breakdown helpful, hit like, subscribe, and let me know in the comments, was Warren right to call Kennedy out, or was Kennedy justified in sticking strictly to the science?